Stroke is when there's problem with blood supply in the brain. Either there's a blockage of the blood vessel or the blood vessel rupture. So there are 3 different types of stroke. The first one is ischemic stroke, and that happens when there is a blockage or narrowing of the blood vessel causing the stroke. The second type is hemorrhagic stroke, and that is a bleeding stroke that occurs when the blood vessel rupture and there's a bleed in the brain. The third type is a TIA, which is a transient ischemic attack, and that is very similar to the ischemic stroke. However, the symptoms don't last long, and they usually resolve within 24 hours. There are about 800,000 people have stroke every year in the United States. So that means every person every 4 seconds, and 1 person dying of stroke every 4 minutes, and that is a very significant number. And these days we have younger and younger people having stroke. The symptoms of stroke include any acute onset of weakness, numbness, problems speaking, confusion. So a good thing to remember is FAST. F for face, if there's any facial numbness. A for arm, if there's any arm weakness. S for speech, any speech problem, and the T is for time. So every time you suspect yourself or anyone having stroke symptoms, you need to call 911 because time is brain. And stroke is a medical emergency, and we have to treat the patient as quickly as possible. Strokes are preventable. So people who are elderly have increased risk for having stroke. Also, people who have had stroke have increased risk for another stroke. You should know your blood pressure because people with hypertension, you should check your blood sugar. People with diabetes have increased risk for stroke. Also, smokers are very high risk for having stroke. People with heart problems, like people who had heart attacks. Also, people with physical inactivity. So I think it's very good that you should exercise every day, eat healthy. A stroke is, like I said, is a medical emergency, and patients have to be treated as quickly as possible. Like I say, time is brain. So if you have to get to the hospital as quickly as possible, because there's a medication that we can give. It's called TPA, and that medication is used to help with the stroke symptoms. However, that medication can only be given if you get to the hospital before 4.5 hours from the time of the onset of symptoms. So that's why whenever you suspect yourself or someone having a stroke, you need to call 911 immediately. When you yourself or someone you suspect having stroke, you call 911 immediately. And again, the EMS personnel will come and get you, and what happens is that most of the time they will check your blood sugar at that point, check your blood pressure, and when you come here to Hendrick Medical Center, there are staff of specialists, and I myself is a neurologist, come and see you immediately. So if you qualify for TPA, you'll be getting TPA, and if your symptoms don't improve, then we have advanced technology that we can give the medication not just through the IV, but directly to the vessel. And then after that, we will check your heart, make sure your heart is okay. We'll make sure your vessels are open, and then you will. If you need rehab, if you're still weak, you need rehab, then you go to our rehab center. And again, Hendrick is a primary stroke center. We have a stroke team here available, and we've been very successful with giving TPA in a very short amount of time, within 60 minutes. And that, again, is a standard protocol. We also have a team of really great neurosurgeons here for interventional treatment if needed. We at Hendrick have started a stroke support group. It's called Surviving and Striving After Stroke. And this is an educational series and social gathering for patients, their family members, and caregivers. Stroke is a very traumatic event, and people will change significantly after the stroke. So we have this meeting every third Thursday of the month. So during this meeting, we have educational talking about risk factors, how to prevent stroke, how to cope after the stroke, the cognitive deficit that patient will have, and how to deal with that. Also, we have a team of social worker helping with resources in the community, helping with financial issues that people have. If anyone have any questions, we are always available for questions. And it is a point of contact for patients to feel that they don't have to go through this by themselves. There are a group of people who are here to help them.